a lot of success stories. One individual in particular was paying a very high premium, and through my assistance and based upon what she was eligible for, she actually could receive Medicaid. So she was just so ecstatic. This burden, she told me, was lifted off of her shoulders, and she can now use that money to pay for other expenses like housing and clothing and food.
Insurance coverage is really complicated. It's just not something that everyday people understand. And so one thing we do at the foundation is support experts that work with people one-on-one, face-to-face, to help them navigate or work their way through all the complexity and pick a policy.
The state is funding a really broad navigator network in all corners of our big state. And our approach has been to be complementary but different from that effort. So we're supporting an enrollment network that focuses on 3 high target populations: low-wage workers, immigrants, and LGBT New Yorkers.
At the New York State Health Foundation, we're funding such experts at more than 50 community-based organizations all across the state. And they're reaching out to people who are uninsured, giving them the information they need to make an informed decision and to help them enroll in a plan they can afford.
Here at Make the Road, the community that we serve that walks in are immigrants and low-income individuals.
Make the Road has roots in the communities that we work in, and we've been in these communities for about 15 years now. A lot of our staff are from the community themselves, so they really understand what it's like to live in the community, to be an immigrant, to not know what you're eligible for, to not speak the language, to struggle finding a job. Through the funding through the New York State Health Foundation, we've been able to hire a full-time person to divide their time between Brooklyn and Queens doing the enrollment work. And there's no way that we would have been able to meet the demand that we're seeing in those offices without having a full-time person.
The community that Callan Lord serves is the lesbian, gay, bisexual, and transgender population, and the vast majority of the folks that we work with are also low income. For many people that access the Affordable Care Act, this may be the first time that they've had health insurance since they were very young. So they may have missed years of primary care, years of preventative care. So accessing the Affordable Care Act and getting health insurance can be extremely effective in your long-term health risks.
So we had people pretty much lined up as soon as it opened. People knew that this was coming and they were excited about applying, and were excited to see what those options were going to be.
So our role here at Planned Parenthood of Nassau County to reach the community is to provide education and to outreach.
Planned Parenthood is really well positioned as a messenger for information about the Affordable Care Act in the community, because we're already out there doing a lot of that work, speaking with people about having ownership over their health care and giving them the resources that they need to do that.
Through the Small Business Assistance Program, we are able to provide services free of charge, and small business owners can contact us at any time with any questions in regards to health insurance. They continue to seek us out because they know that we can provide reliable, trustworthy information.
The foundation has these priorities of really getting the word out to these sort of niche populations, and the Community Service Society of New York is providing technical assistance to those funded grantees where, doing healthcare bridge work may not be their bread and butter. They may have other organizational missions, and we're enhancing their capacity.
Frontline has always been available to the low-wage retail community and in other services besides healthcare.
The Affordable Care Act is changing a lot for retail workers, because now they're able to actually get comprehensive health insurance from having nothing at all, from not going to the doctor for 5 years to actually being able to go whenever they need to go. And just having that peace of mind to say that, God forbid, if something happens to me, I'm taken care of.
We know that people who have insurance coverage do better in terms of their health and in terms of not having as much stress in their life, worrying about it. And that's one reason why we care about getting as many people in New York covered with insurance as possible.
The most gratifying thing is to know that I'm actually helping someone. Like, the same help that I wanted when I was in retail is what I'm actually giving to someone.
So what I wish that everyone knew about the opportunities with the Affordable Care Act is the extension of coverage that's available and the protection for many consumers that's out there. And we just want to make sure that we provide as much as clarity and information to them to make the best decision as possible.